can you explain to us what HSC brings to an aged care operator in the area of sensors such that you have had such a fast and rapid take-up by clients?
I think is that we step back from it and actually not looking at the sensors, Chris. What we really wanted to do is that what are the problems? And we talk about our 5 major challenges of the aged care industry. Number 1, compliance. Everyone gets it. But that is a really big issue for the executives, is that how do we ensure compliance? And as I mentioned with my background, prisons, hospitals, banks, compliance is a must. And in this situation is that we've covered off compliance. We're also looking at staff engagement. We know it's at an all-time low, but how do we do more with less? So we've got this situation is that compliance is increasing, staff engagement's lowering, and skill set's lowering. So something's got to give. So what we have done is created a way is that we're putting sensors in that increase compliance, that also then support staff. So if something gets missed, it doesn't get missed. And we cover up and we also get that sorted out. The piece from this though is that how it autonomously does it. And so to give you an example, and it's the best way to communicate it, is I wanted to show you this sensor, the sleep sensor. So this is a sensor that replaces bed mats. So I personally have sold enormous amount of bed mats to aged care providers over the last 20 years and made a lot of money out of it. The thing is though, is that bed mats are no dignity for the resident. Nurses hate them because they false alarm all the time. They break down every year. There's infection control and so forth and so forth. This sensor is at the same price and it replaces a bed mat. It goes under the leg of one bed with a ramp, okay? What that does, it now monitors in bed and out of bed. It also uses a new technology that monitors heart rate and breath rate. It monitors movement at the level of the bed, so we monitor bed sores. It also, when you get out of the bed, it will turn on the night light for the ensuite. When you get back into bed, it will turn off the light. So what is the value of that sensor? Well, one is that I now have 12 hours of data on the quality of sleep, how well they've slept, their heart rate and breath rate. I don't need to do staff rounding. So now staff are more engaged because they're not doing menial tasks. They're not disrupting residents' sleep every 3 hours. And we've got full data for a level of compliance. And this sensor is the same price as a bed mat and lasts around 5 to 7 years. So that's an example, I suppose, of how a sensor can increase compliance, improve staff engagement. Thirdly, improve the environment for the resident. And fourth, we've actually got some data that we can show to family members that they are actually being cared for and looked after.